what the research says about why we do chair yoga at the cognitive empowerment program. Does the research really say that these practices can help our memory and cognition? Spoiler alert, the answer is yes. If you've been hanging around a little bit, you know that that's the case, but you might be wondering why that is. And we're also going to talk a little bit today about using yoga and some of these practices to help self-soothe or to help self-regulate, especially in those moments when things seem to really pile up or that anxiety just really seems like something that is pulling us out of the present moment. And one of the things that we know about having stress is that when we are stressed out, it's a lot more difficult for our brain to function, recall information, and make decisions soundly. So one of the things that we want to do is just learn a little bit about some of these self-soothing practices as a tool to help support our memory and our cognition. So what does the research say? This is our cohort 1, actually, in the picture on the right-hand side. This is right in the beginning of 2019 when we first opened our program up. And one of the things that we know to be true, one of the reasons that we offer these weekly classes at our center here in Atlanta is because the research says that these physical practices and the mental exercises that come along with them in our yoga sessions are really beneficial to people that have early stage memory loss and to people who progress into that dementia phase. And not everybody progresses from early stage memory loss into dementia. One of the things that we've learned here at CEP over the past 5 years is that these lifestyle changes that we offer week to week are a huge impact and can really change the trajectory of what that diagnosis, what the symptoms of MCI end up looking like. The people who've been a part of our program for a year plus, what we find is that their condition on average stabilizes and they're able to keep their memory that they have now as long as possible. So one of the things that we want to really share with our audience is that, yoga is a really good thing for cognitive function, and that's one of the things we want to highlight, but it also is really great to support mobility and to help with pain management. Many folks are experiencing what it's like to live with chronic pain or acute pain, and doing these simple exercises, even as short as 1 class a week for 12 weeks, what the research says is that it can have a huge impact on those mobility, on that experience of pain, and on our memory and cognitive function. So it not just helps with cognitive function, but one of the more recent research studies from 2020 shows that it can also really improve our processing speed. So there's something about the dual tasking of watching a yoga instructor, listening to the instructions, embodying what the instructor is saying, at the same time that we're kind of tuning in and noticing what's happening within our own body, that can really support not just physical benefits, but also processing and cognitive benefits. So we are looking as far back as 2012 with some of the research that we're pulling that says that older adults who develop skill sets around self-compassion have a lot easier time with their psychological well-being. Not just that, not just the impact that it has on mental health, but that it also gives a lot of relief in those physical health challenges. And people who participate in a chair yoga class once a week also report not using assistive devices like canes and walkers as much. So something to think about as we build our schedules. We know, at CEP, we're always encouraging everybody to be more social. And one of the things that we know is that when we do the work together, especially in person, if you can find some local classes, it amplifies the benefits of the work. So, being part of this community, coming into these sessions, connecting with other people who have similar experiences as you, is something that we also know can help keep us as independent as we are now, as long as possible. So, we'll explore some of those today. We're going to do some self compassion and some mindfulness practices, some really basic introductory ones. One of the things that I also found really great in the research was that you don't have to do a formal yoga class to practice self compassion or mindfulness. We can be really mindful while we're washing the dishes or having a cup of tea. But one of the places that the benefits of mindfulness are like really, really, amplified again are being in nature. And it's May right now. It's springtime. It was rainy all weekend long, but the sun's out today. And being in nature, especially when we take moments alone or in silence in nature, can really help with lowering some of those cortisol levels. Cortisol is the hormone that's produced by our adrenal glands. It helps us to regulate metabolism, to regulate blood sugar. It helps regulate our heart rhythm and even helps with inflammation. So, when those cortisol levels get really high, that stress hormone gets really high, sometimes our nervous system takes a really big impact as that stress response gets activated. When we're stressed, when we're triggered, that part of our brain that works with sleep and immune function and memory and digestion can get really disturbed. So, even just taking a walk once a day, or even thinking about adding it into your schedule once a week, can be a place of reprieve, not just for your physical body, but also for your nervous system, and help get some of those sleep and digest responses regulated again. And of course, if you've been with us in our yoga sessions before, you know that we're going to do some breath work and some relaxation techniques. It's nice to get a guide with some of those things. Sometimes it's kind of hard to do those alone. And there's lots of apps, lots of videos out there, but we'll give you a link to our YouTube channel with some of our Tai Chi and yoga videos in the chat today to share with you guys as well. All right. So if you didn't get the memo, one of the things that we just really want to emphasize is that being kind to yourself, using encouraging self talk, having and developing self compassion is something that really supports our cognitive health, our physical health, and our emotional and spiritual health too. We know with the research now that having a diagnosis like mild cognitive impairment doesn't just affect us on a biological level or a social level, but it also really can hit us in a spiritual level, questioning things like, who am I if I don't drive my car anymore? And not that that's going to be the case for everybody, but starting to develop some of this compassionate self talk through things like self kindness and meditation can really help with our psychological well being and help us get away from some of that self criticism that sometimes gets us really wrapped up and kind of takes away from enjoying and cultivating joy right here, right now. And that's one of the things we know in this program that the diagnosis of mild cognitive impairment can't take away from us is being in the present.